It is my absolute pleasure to introduce our keynote, Dr. David Wong. Starting March 18th, 2024, Captain David Wong will be the new Senior Advisor for Sickle Cell Disease in the Office of Policy and Legislation with the Office of the Assistant Secretary for Health, U.S. Department of Health and Human Services. HHS. Previously, Captain Wong chaired the interagency HHS SCD work group during 2018 to 2020. Captain Wong's past assignments have included the HHS Office of Minority Health, the Centers for Disease Control and Prevention, the National Park Service, and the Indian Health Service. Captain Wong deployed multiple times during the COVID-19 pandemic to support telehealth implementation and equitable distribution of COVID-19 monoclonal antibodies and other therapies. Captain Wong received a bachelor's and medical degree from Duke University. He completed his pediatric residency at the Children's Hospital of Philadelphia and started his public health career as a CDC Epidemic Intelligence Officer. Join me in welcoming Dr. David Wong.
Great. Thank you so much, Dr. Bailey and Ashley. Thank you for the invitation to present today. And welcome to everyone at this policy forum. Next slide, please. So I just started this position, as you heard from Dr. Bailey yesterday, as the new Senior Advisor for Sickle Cell Disease. I'm really excited to be back in this space again and see old friends and colleagues. Next slide. So as Dr. Bailey said, I was the chair of the HHS Sickle Cell Work Group from 2018 to 2020 under Admiral Giroir. Some of you may have worked with me in the past. When I look back on this time, it was such a privilege really working with Admiral Giroir and many of you here on the phone today, the sickle cell community, really trying to advance new initiatives. Many of them, as you can see, some of the events that are on this page here today. I think the one that we're extremely proud of and that I'll be working on over the coming months is the National Academies report, which you see on the left. And this was a consensus study report. It was issued in September 2020. And it's really the first national strategic plan and blueprint for sickle cell disease since sickle cell first received federal funding back in 1972. So it took really almost 50 years to have this comprehensive document. And much of our work here in the office will include addressing some of these very incredible, these important and priority recommendations in that report. Next slide, please. So I know we're here to talk about advocacy, and I'll just start off saying that advocacy is one of those things that you really never have too much of. I remember when I was growing up, I would hear things like, you can never have too much money, or you can never have too much success. Well, I would actually disagree with that, because I think that you can have too much money. Too much money can potentially make you greedy and entitled, and it can make it hard to figure out who you can trust or not trust. And if you have too much success, you can be out of touch or lose empathy for others who may struggle more than you do in life. But advocacy is one of those things where when you're looking at advocacy as advocacy for others, which is really what this space is about, you really cannot have too much of that. Every voice matters, every voice counts. And so I really applaud all of you for being part of this forum to really build your skill set, to really advocate as best you can for the sickle cell community. Now, I know that a lot of the framing for this forum and the way we're talking about advocacy here is in many ways about legislative advocacy. And of course, as a member of the executive branch, we cannot do that kind of advocacy. There are laws prohibiting that. But I also think of advocacy in a broader lens in terms of just advancing an agenda, committing to projects, doing the best you can in the area that you're serving in. And so with that, I want to talk a little bit about some of the approaches or levers that we all have. And I think this is something that I've had to learn myself in the different positions that I've had in the federal government now over 20 years. Depending on where you work, the level you are within an organization, the levers or opportunities that you have to make change, influence change, can vary. So if you think about things like someone working in biotech or in government or at a CBO or in academia. There are different levers or opportunities that you have. And part of the challenge for all of you here in the audience, I think today, is to really understand what are the levers that you have the most influence over. And those are ones that I think then if you can think about how you can get the buy-in and support to get those levers to work in your favor, then that's how you can really help to advance the needle. Next slide. So from the federal government perspective, there are many levers. I'm not including them all here. I think that the bottom two here with policy and funding, these are ones that I think you'll be talking much about with this forum. These are levers that sometimes take more time to implement. That's not to say that we aren't working on those levers ourselves here within the government and with our team here on sickle cell. But some of the other levers on the top are ones that are also important and are ones that we can, continually, we have a little bit more access to on a regular basis. And they're going to be important for us as we move forward with the sickle cell portfolio. And so I just want to mention here the warrior voice and engagement is so critical. I'm so grateful really for this opportunity to be presenting here with all of you today. The warrior voice, really understanding what the needs are, how we can help. We're very sincere that we want to engage more than we did even back in 2018 to 2020. It is really essential to everything that we do. And then with convening and coordination, so in this new position that I started yesterday, we'll be trying to coordinate within the different federal agencies that support sickle cell. And we want to align our interests as best we can. We want to find areas of synergy, maybe new opportunities that each individual agency may be hard to do on their own without this interagency space. I know you'll hear later today from Mandy at HRSA, Dr. Houlihan from CDC. They're incredible partners. And I know I'll be working with them more along with other agencies as we move forward. And then promotion and awareness is so important. I know this is kind of a sister of advocacy in some ways, but I think helping all stakeholders, general public, people that are involved more deeply within the sickle cell community, lawmakers, biotech, et cetera. There's so many different stakeholders that we want to make sure that they're really aware of what we're trying to do and to build. Next slide, please. So this, I'd be remiss if I didn't mention this event that happened last week. So this is a warrior-led listening session that Linda Wade, I don't know if she's in the audience today, from the Sickle Cell Association of Texas, Mark Thomas Foundation. She helped coordinate this event, like literally within 10 days. Admiral Levine, the 17th Assistant Secretary for Health, the successor for Admiral Giroir. She was in town in Austin for a nutrition panel at South by Southwest and wanted to add some other events to her schedule. And so with Linda's help, you were able to really put this event together. And there were warriors that came from Houston and San Antonio and Dallas. They really wanted to be part of this event. And you can just see from this picture, kind of the energy and the intensity of the engagement. And Admiral Levine really appreciated this event. I know Linda did as well. And so this is the kinds of that we want to continue to foster here, this kind of engagement with the sickle cell community. Thank you to Linda, if she's on the phone, for all your work in getting this event together. Next slide, please. So I just wanted to end, I know I just have a short, 10 minutes or so to talk, but after I left sickle cell in 2020, I went to deployments. And then the last 2 years, I've been really working intensely on the community health worker community. And it's been very interesting because through my work with CHWs, I've learned about how they advocate and some of the work that they do. And they also work very closely with many of the stakeholders that sickle cell works with, like, for example, the Medicaid offices. And so there were some things that I learned from folks that I wanted to just share with you. Maybe some ideas for you to consider. I know I just have a couple minutes. But one is each state Medicaid agency has a medical care advisory committee that's required by federal statute. And these committees include consumers and patients. And so this is something where I encourage folks to consider attending some of these public meetings or becoming a voting member. It can supplement a lot of the other Medicaid work that I see you're doing in the therapy space, but also a great way to get more engaged. Next slide, please. And then I know many of you on the call also are part of organizations. And one thing that I think the CHW community, as well as others that I've worked with, have really benefited from is partnering and learning from other successful organizations that have advocated and learning best practices from them, getting in with their network, understanding how they achieve their work. And so I just wanted to share, there are a couple of these networks of advocacy organizations. I don't know if Sickle Cell is part of, but this might be something folks might be interested in joining. And if you're interested, I'm happy to talk offline and help make connections through some of the connections that I've built through CHW and other sectors. And next slide. Oh, so that's it. So I just really wanted to, again, just express my thanks for the opportunity to present today. I'm really excited to be working again with Sickle Cell, and I hope there'll be many opportunities to work with Sickle Cells, the consortium, and others, and many of you here on the phone today. So thanks for your time and attention.